Erectile dysfunction is the inability to get or maintain an erection that's strong enough for intercourse between you and your partner. Erectile dysfunction is a lot more common than most people think. If we look at men over the age of 40, about 40% of them are going to have erectile dysfunction. If we go to men over the age of 60, about 2/3 of them are going to have erectile dysfunction. So it's a lot more common than you may think, and just most guys aren't talking about it. Erectile dysfunction is caused from a variety of factors, including aging. As all men age, our arteries aren't as dilatable or pliable as they used to be, to things like pelvic surgery, high blood pressure, diabetes, and high cholesterol. All these things combined cause issues with getting or maintaining an erection the way you want it to. As a doctor, I see men who come to see me because they've got issues getting or maintaining an erection, and we diagnose them based upon their history and doing a physical examination. A lot of men, though, who are sitting at home may also know that their erections maybe aren't as strong as they used to be before and aren't seeking care and aren't getting evaluations and treatment. And so those guys have erectile dysfunction, most likely just aren't seeking care for it. For most men, erectile dysfunction is based upon the ability for their arteries to dilate. So things like exercise, weight loss, being healthy, all go into how well their arteries can dilate and how well that works. Even with those things though, guys who control their diabetes really well, who control their blood pressure really well, will and can have issues getting or maintaining an erection. So it's not like it's fully preventable for all men, but there are things that you can do that both help your ability to kind of get or maintain your erection and or make it last longer when you're on a modality or treatment. The goal of seeing a person like me who specializes in men's health and in erectile dysfunction is that we're experts in kind of the different areas and treatment options that are available. We also understand the risks and benefits about all the different treatment options and can give you an honest opinion based upon your scenario and create a personalized approach to your care. Most men have heard about Viagra, Cialis, or Levitra as options for treating erectile dysfunction. But a lot of guys haven't heard about the other options, either when those medications stop working, or when those medications have side effects that they don't like, or when they can't take those medications. The options for treating erectile dysfunction when we're looking at other options are things like a penile implant, which is a surgery to put inflatable cylinders in the penis to allow you to have control over your erections, injections into the side of the penis to give you an erection, or a vacuum erection device. I take a personalized approach to your healthcare. What that means is sitting down with you and talking about the different treatment options and determining the risks and benefits of each of them. It also means sitting down and talking about kind of all those options and seeing which options you may want to try and or which options may be contraindicated for you, which means not available for you based upon your other medical issues and medical problems. It also means with you having a conversation with your partner or spouse to understand and see what treatment options they may be interested in, and working together as a team to create a pathway forward. As you'd expect, the satisfaction rates vary based upon the different treatment options. If we start with Viagra and Cialis, those options have high satisfaction rates while they work, but at some point they stop working and then we start talking about the other options. The option that has the highest satisfaction rate is a penile implant, and that has a greater than 99% or 98% satisfaction for the patient and their partner, and that's because they get a reliable erection that works when they want it to. Things like injections have some satisfaction rates that are about 60 to 70% depending on which papers you're looking at. The vacuum erection device has the lowest satisfaction rates for most men because it has issues with reliability and it is a little bit more cumbersome to use. You may be asking yourself, what are the long-term issues with not having erections? Well, there's lots of issues when you guys aren't getting erections. It comes down to you and your partner and the intimacy that's created when you have good erections and can have that physical intimacy. It has issues with self-esteem and the way guys view themselves and how you project yourself out in the world. So there's lots of consequences with not getting good erections and not being able to feel confident in your ability to get or maintain an erection.